Hi, it is Dr. Lanice. I am a best-selling author, speaker, blogger, social media expert, and I take care of sick babies for a living. I love to help tired, stressed out, depressed moms in the NICU who have a preemie. I like to help them better understand their baby's illness, more effectively communicate with their NICU team, and most of all, know and understand that they do not have to do it all alone. So I am back today again on Wednesday at 7 p.m. Eastern Standard Time for another Facebook Live where I talk about all things preemie and all things NICU. So today, in honor of the fact that we have Father's Day coming up this weekend, I wanted to talk to you guys about 6 reasons why preemie dads need love too, okay? So the reason I'm talking about this is because a lot of times in the NICU world, everything is very mom-centered, right? And that makes sense. But we want to make sure that we are taking the time out to acknowledge and talk about our dads as well. So that's why we're going to talk about this today. So reason number 1, right, why preemie dads need love too is because they do an awesome job of supporting our preemie moms, right? So we know one of the reasons why we focus on moms a lot, right, is they bond with the baby regardless of however many weeks or months it is that they are pregnant before they deliver. And so it's kind of this traumatic experience to realize that the delivery they were expecting isn't going to happen and then have to be separated from their baby so soon right after. But we also understand, right, that this happens for dads too. We know that this is not what you expected and that you are also dealing with feelings of separation. But our dads are so great about jumping in there, being supportive for mom, making sure that she has the help that she needs while she's recovering, whether that be from like a vaginal delivery or something that needs a little bit more significant recovery like a C-section. We are so thankful that our dads they jump in there and help and make sure that mom gets rest. You know, they're kind of the first line of defense. They make sure that, there's not too many visitors, that mom is not getting overwhelmed and doing all these different types of things. So we are so thankful for our dads for that reason, for jumping in and kind of being helpful, especially kind of in those first few days before mom goes home. A lot of times our dads are coming down, mom's working hard to give us that breast milk so that we can start feeds for the baby, and they will all, come down while mom's recuperating or taking a rest and bring that breast milk down. So we just are thankful for our dads for kind of jumping in there and being a support for mom because, she's also going through a lot, and so she really needs somebody to be there for her as well. So that is reason number 1. Reason number 2 is, every family dynamic might be a little bit different, but we're also thankful for our dads because sometimes, they go back to work, which allows mom the opportunity to be at the bedside, right? Which helps because she can do putting the baby to the breast and stimulating, getting her, milk production, which all helps to get breast milk, which we know is best for the babies. So again, mom is able to be at the bedside and kind of have bonding time with the baby and do all those things. But unfortunately, right, when there's a sick child, when something is going on and there's a new situation that you weren't expecting, we want the world to stop. But unfortunately, that doesn't happen, right? So there's bills that are due, there's maybe different responsibilities going on that sometimes, families feel like they're being pulled in different places. But one dynamic that we see is that our dads go back to work so that mom can use some of her time off to be with the baby in the NICU and be at the bedside every day. So for that reason, a lot of times, right, our moms do get more attention because they're a little bit more visible. But we do appreciate the fact that our dads are doing this. And, there are some dads who, because they work during the day and they're not able to be there during the day, then they kind of come in at night. And the night is sort of when we see them. And that's kind of when they get their opportunity and their time to sort of spend with the baby. But unfortunately, right, that's kind of like burning the candle at both ends, right? If they're spending all day at work and then, dad, you're spending time with your preemie at night and then maybe running home to catch a nap or whatever it is before you go back to work, that can lead to lots of stress and anxiety and burnout as well, right? So we talk about this a lot for our moms, making sure that they get rest, saying that if you are here all the time at the bedside, then you're going to burn out eventually. But we also want to remember to sort of talk about that dynamic with our dads as well. So a lot of times we'll say, treat the mom to a spa day, give her a gift, take her out to lunch, take her out for a coffee or tea or whatever. But we also want to make sure that we remember to include that for our dads as well, right? So dad might like a spa day too. I don't know. Or maybe he wants a golf day or, for that particular dad that you want to reach out to him and do something that helps him to get a break as well. Because, we don't want our parents to be burned out. This often, especially for our micro preemies who can be in the NICU for a long time, we want to make sure that both of our parents are supported and are taking breaks when they can, because, often that stress and anxiety and that burnout can lead to lots of trouble and issues. And sometimes there's relationship dynamics and problems that arise just due to having a sick baby. All these different things can happen. So we all want to try and support not just our moms, but our dads as well. And remember that they're making a sacrifice as well, and they're dealing with a lot of stress as well. So we don't want them to be forgotten, right? So that is the second reason why preemie dads need love too. So going into number 3, this makes a lot of sense, right? So if the dads are all day at work and then maybe only coming in late at night, and sometimes dads just can't come, unfortunately, sometimes families live far away from the hospital where, they have a NICU that can take care of a preemie, and so they can't come until maybe the weekends. So what ends up happening is they get a lot of secondhand information, right? So they get information from mom because mom's been there and she's been getting the updates, or if they call in and they speak to the nurse, then they're getting updates from the nurse, and sometimes they're not getting information directly from us as the doctors. So we also want to, appreciate that and encourage dads. I encourage you to, just like I've mentioned in other videos before, realize that you can always call to ask to speak to the doctor that's taking care of your baby to get a real-time update on what is happening. So we appreciate the fact and know that you might be back at work, and so you're unable to be there, but we still want you to feel a part of the process. We don't want you to feel like you don't know what's going on with your baby. And for certain things, right, it's just better to sort of hear it firsthand. We start talking about things like IVH, right? So when your parents in the preemies, you hear or know that term, that's intraventricular hemorrhage, where sometimes we have bleeding in the brain in preemies and the ventricles because the blood vessels and everything that supply the brain are not fully developed. So that can be a hard conversation, right? To hear that from mom, it takes a little bit to understand it. And sometimes it's visual. Sometimes we need to use pictures and things to help you understand. So, hearing that from another person can be hard. So you always want to call and, get an update directly, or if you know that there's a day off that you're going to have or a specific time when you're going to be able to come into the hospital, let us know and say, you know what, I haven't been able to be here, but this particular day at this time I'm going to be here. Can we set up a family meeting, right? That is especially going to be important if something is going on with your preemie, right, where they need a surgical procedure to be done, or there's a major diagnosis coming through for your baby, or there's something going on that we really want to make sure that you really understand what's happening and that you have the opportunity to ask questions. So things that we can do. Hi, Portal. Thanks for joining the Facebook Live. Why don't you type in the comments to let me know where you're from? But we really want to make sure that, you get to be a part of this process. So one of the things that we can do is set up a family meeting. So what we're talking about is 6 reasons why preemie dads need love too. And so one of the things that I was just talking about is because often they get secondhand information, right? So dads, one of the things that you can do to help out with that is to, again, let us know when you're going to be there so we can set up a family meeting, even if it's nothing major, right? It might just be that you just haven't been there in a while and you kind of want to know how your baby's progressing and, how close is your baby to getting home? What's the next big milestone that you should be looking for? Things that we talk about every day on rounds that you might be missing if you're not there. So I encourage you to call and talk, to the doctor that's taking care of your preemie, or to set up a time where we can have a family meeting so that we can make sure that you are informed as well. Okay, so that's reason number 3. Reason number 1 was because dads are awesome at being a support system for mom. Reason number 2 is a lot of times our preemie dads, right, they're back at work. And so they may see baby only at night or on weekends and different times. So, that's another reason why they need love too. And then number 3 is because oftentimes they get secondhand information. Awesome. From Forest Park, Illinois. Okay, so I see where you're from. So just let me know if you have a preemie or if you know somebody that has a preemie. Thank you for joining today. So reason number 4, right, why preemie dads need love too is because oftentimes they can feel isolated and alone. So some of the research and studies that have been done about dads and kind of what their experience is like in the NICU, this is what they've admitted. Sometimes they feel very isolated, right? So depending on the NICU that you're at, right, they may have pumping rooms for moms. And again, we talked about the fact that moms are at the bedside a lot more often, so they bump into other moms. And so they get to form bonds and they get to talk with each other and kind of establish relationships. So dads have mentioned, they don't have that, right? They don't have that reason to kind of come together, like needing to pump or something like that. So it's harder for them to sort of run into other dads. And so they feel like they're missing that piece. They're sort of missing that support system that they need, that sort of moms have innately, just by the fact that they're there and, they kind of get into these spaces. So one of the things that I would encourage dads to do is to realize that we have NICU parents support groups, right? A lot of NICUs will have this. So I know the feeling is maybe not wanting to go because you think that mostly moms are just going to be there. But you know what? If you are the brave soul that says, I'm going to go, then more and more dads will come, right? If you keep feeling like, well, I'm not going to come because I don't want to be the only one, then every single dad is always going to feel that way and they're never going to come. And the other thing that you might be surprised about is even if you go and you feel like you're the only dad there with a bunch of moms there, you're still sharing a very similar experience, right? So you still are going to be able to express your feelings and talk about what's going on. And the group is going to be there to sort of support each other. So I don't think, don't feel discouraged that other dads aren't there. You're still going to be getting something from that. And actually, in looking it up a little bit, I realized there are some NICUs that have sort of NICU specific support groups just for dad. So you definitely want to check with the hospital that you're at to see if they have a NICU support group just for dads. And if not, reach out, look online, right? I feel like moms tend to be better about this because there's so many moms that blog and there's so many different support groups that they have, and they have conferences and everybody knows about preemie moms. So dads, you kind of need to get out there, be a little bit more active as well. I'm sure if you go and I'm sure if you look online, you'll be able to find that there may be a support group for dads out there, in the online community if you can't find it in real time at the hospital where you are. And if not, you know what? You can form it, right? If you take the initiative and do this on your own, you'd be surprised how many other dads are out there that feel just like you and will kind of join something like that and be a part of it. And sort of additionally, if you once again, reach out to your NICU team and let us know this, then that's something that we can think about. Maybe we can reach out to our dads that we have in the NICU at that time and see if we can organize that to help it. So we want to be there not just to take care of the baby, but we want to help and support you as mom and dad as much as we can. So if you kind of let us know, dads, that you're feeling this way, then we can try to do what we can to support you. Okay. So number 4, the reason why preemie dads need love too is that sometimes they feel isolated and sort of disconnected and alone from the process. Okay. So similar to that, reason number 5 is that some dads report that they just have a hard time bonding with their preemie in the NICU. And it makes sense, right? For some of the reasons that we just talked about. The fact that they may be at work so that mom can be at the bedside. They're getting that secondhand information and they may not be there as often. All of that, can end up being a barrier, right, for you to sort of bond with your baby. So I did another video where I talked about before how you can remain in contact and in touch with your preemie while they're in the NICU. And other than breastfeeding, pretty much everything that I talked about is things that not just moms can do, but dads can do as well, right? And one of those things is skin to skin, right? We talk about that. We say that's so great. It's so good for the babies. And it's good when mom does it, but dad, it's good when you do it too, right? So you can get to hold the baby. This is where the baby comes. They put the baby on your chest, sort of wrap the baby up with a blanket, and you just get to have that time holding your baby close to you, heartbeat to heartbeat, where you have that time where it's just you and the baby and you get to bond with them. We really encourage this. Again, it's one of those things where sometimes it ends up being a little bit mom-centric, but we want you to realize that this is something that you can do as well. So some of our dads, they don't feel comfortable. I don't know if it's a macho thing. They don't want to do it. But if you are a dad out there and you are feeling like you're having a hard time bonding with your preemie, this is absolutely one of the ways in which you can do that. So that's something that you absolutely need to take advantage of and ask your NICU team about. Other things that you can do is, again, like I mentioned in the other video, is participating in baby's cares, right? So in the beginning, if you have a very sick baby, you might not be able to do that. But as they start getting a little bit better, there's certain things that you can do. You can help change the diaper. Sometimes you can help check the temperature. You can start helping to feed the baby when your baby starts, getting to about 34 weeks, right, where they can start taking the bottle. You can sort of work with all of those things. So again, we know that you might not be able to be there every day, but if you know that there's going to be a time when you can come in, talk to the baby's nurse, right? Talk to your bedside nurse so that you can coordinate a time. If you know they're going to get fed at, 9 in the morning and you can be there, try to be there so that you can participate in that. If you know that you want to participate in bath time, then you want to coordinate and call and find out, right? When is the nurse going to be doing a bath for the baby so that you can participate in that as well. Hi, Dr. Shanika. Thank you for joining. We are talking about 6 reasons why preemie dads need love too. So we really want, dads, we want you to feel a part of the process. So if you're having a hard time bonding with your preemie, again, reach out. You have to let us know what's going on. You have to let us know how you're feeling so that we can do what we can to get you in, as part of this process. But one of the things that I think is really a great way is skin to skin. So I really encourage you dads that you really want to do this. This is not something that's just for mom. It is for you as well. And this is a great way for you to kind of take part in that. Okay. And so, reason number 6. So again, along the same vein, right? So we have all these stereotypes for men and women, right? So one of the things for men is that they're doers, right? So they want to go in and they want to do and they want to fix the problem and find the solution right away. So dads, when you ask them, when you do studies, when you talk about it, they explain that they kind of have this feeling, they avoid the NICU actually, right? So they don't come in because it's sort of hard to see their baby so small, so sick, sort of with all the lines and tubes. They're hooked up to the ventilator, to the breathing machine, and they don't like the fact that they can't do anything, right? They can't go in and make it better, right? So this is a very hard environment for the NICU. There's lots of ups and downs with it. We often tell our parents, listen, it is a day by day. Sometimes there are setbacks, but there are also victories as well, right? And every small step that the baby is taking is a step forward in the right direction. So we know that, sometimes this is something that you're having a problem with. And so it might make you feel anxious and you might feel sad about it. And you might feel depressed about it. So one of the things that we know is that parents, right, who have sick children or like a preemie in the NICU, they're at a higher risk to have depression and anxiety as well, right? And like we talked about before, dads are back at work. Sometimes you may visit the baby at night. So you're dealing with a lot of stress. You're maybe not getting a lot of sleep. You're feeling like, you don't want to be there. You feel disconnected. You feel like you can't fix it. And you might be dealing with a lot of overwhelming feelings, right? And, it might be, again, we talk about those stereotypes, right? Feeling macho, that you might feel ashamed that you're having these feelings and that you're not totally in control of the situation or totally in control of your emotions and how you feel. This is okay, right? You are absolutely not alone. We know that when we talk to other dads, they absolutely feel this way as well. So this is another situation, right, where I encourage you to reach out and to let somebody know. We know that you're there for mom, and that's awesome. We love it. We love that you're being a support system for mom. But, you guys both have to be a support system for each other, right? So we know that you need somebody to look out for you as well. And so for moms, sometimes it's a little bit easier because we have a direct line to them through their OB doctors. We know that they have to follow up. So if we see a mom that's having a hard time and worried she's depressed and we're worried that she needs some extra help, we can sort of reach out to her OB to say, she needs to come in. Can you make sure that she gets the appropriate referrals to whoever she needs to see or whatever medications she might need? Or we might know ahead of time, right, that a mom has a history of depression and anxiety. So we kind of are monitoring a little bit more closely. But we often don't know that information about dads, right? We don't know if you have that background, and we don't have direct access to your healthcare provider. So if you are a dad out there and you're dealing with these feelings and you are not exactly sure what to do, I want you to know that that's okay. You are not alone, and just reach out to us. Reach out to your NICU team, right? So even though we might not be your primary care provider, we're not your doctor, we can work with our team. We can work with our social worker. We can reach out to kind of get you next steps to kind of figure out what you need to do to get help. Okay, so if you are out there and you're sort of feeling helpless and hopeless and you feel a lack of control, and so that's leading you to sort of avoid the NICU and not coming in to want to spend time with your baby, which again means that you can't bond with your baby, which what does that do, right? That just leads to more isolation. So we want to reach out to you. We want to know that you're having a hard time, and we want to help in whatever way we can. So please let us know, and also reach out, right, to support groups. Again, that goes back to finding other support groups as well, so that you can talk to other dads who might be feeling that way as well, and they can kind of share their experience and sort of what they did to get over it. But sometimes you even need that extra step where you need to see a healthcare professional, and so we want you to get that help if you need it. Okay, so today, again, we talked about 6 reasons why preemie dads need love too. We talked about number 1, they are a great support system for moms, so that's a great reason. Number 2, they're making that sacrifice to be back at work in the beginning so that moms can be there at the bedside every day for the baby. That was reason number 2. Reason number 3 is that we know sometimes you get secondhand information, right, because you're not always able to be there. Number 4, you deal with feelings of isolation and being alone because you don't have that ability to sort of bond maybe sometimes in the way that preemie moms do. 5 is that you're having a hard time bonding with your baby, your preemie. And then 6 is because you're dealing with this feeling of not being able to control the situation, and you might be feeling sad or depressed about that or having a lot of anxiety. So I wanted to take this time out to recognize our preemie dads today because we have Father's Day coming up this weekend. And like I said, we know that in the NICU, everything tends to be mother-baby. We are very sort of mom-centered, but we want to let you know, dads, that we see you and we appreciate you, and we want to help support you just as much as we support moms. So encourage you that, if there's things that you need, things that you're feeling, things that you need help with, please reach out to your NICU doctors, please reach out to your NICU team and let us know. But we appreciate you and we appreciate what you do. So once again, thanks for joining. This is another weekly Wednesday Facebook Live at 7 p.m. Eastern Standard Time. So thank you for joining. I am Dr. Lanice. You can find me all across social media as at Dr. Lanice MD. That's the at symbol DrLaUnicemD. My website is up and it's active, so also check out my website. That's www.drlanicemd.com. And I'm wishing a very happy Father's Day to you preemie dads out there. I hope that you have some time to go in and spend with your preemie. There are still ways that you can make it special, even if your baby's in the NICU. You can decorate some onesies. You can just go and spend some time. Do whatever you need to do, but know that you can still make that a special and lasting memory. There are some NICUs where they do pictures with dads and babies for Father's Day, and if not, you can go in and do your own. So I encourage you to use this opportunity, right, to bond with your baby and connect with your baby as well. And I hope to see you guys next week for my next Facebook Live. Have a good evening. Bye.